No other reason why you are constipated except low thyroid levels.
Industry of gym rats, they are taking egg whites. It's a big alarm for them.
Proteins are not going to reduce your insulin spike. Proteins are there to break down into branch amino acids to build muscles.
Carbohydrates are important, but quantity is important.
Key is balance. It has to be balanced for your metabolic rate. Unless the meat you are eating has fat on greens, you will not be able to get the substances. So it only comes back to one thing: plants. Any type of blender will have a motor. That motor consists of heat. Anytime you blend, that heat dissipates out into the food. Your microbiomes will die.
It dies only with that heat also?
Any heat at 40 degrees, microbiomes tend to die.
What if somebody has done the damage to the liver by drinking alcohol? How can I take off that damage?
You can't. That's where the stem cells come in.
Take liver detox supplement and start drinking alcohol.
Yes. If you have fatty liver, technically, something is wrong.
Welcome guys, welcome to Miduty Talks, and today we have Dr. Sunita from Malaysia. She's MBBS MSc and she's IACT from USA, Europe. So in today's podcast, we're going to talk about thyroid, hormones, and a lot of nutrition, how you can get your minerals right, how you can look beautiful. You know, if you want to have a baby skin at age of 50, today's podcast is for you because we have a right example in front of us, Dr. Sunita. So Dr. Sunita, welcome to the show.
Thank you.
So let's start with hormones.
Yes.
My first question is why girls are getting periods so early these days? Because I got my periods when I was 14, my mom got out at 16, and it's just shifting. Now girls even at 9 years old are getting periods.
So when we are talking about periods, you must understand there are 3 stages in life. Okay, you've got the pre-puberty, you've got the menarche, then that's called from menarche to menopause, it's called your reproduction age group, and then we've got postmenopausal. Okay, so in ladies, as humans, we have 3 stages in life, right? Now what will code for menarche is the amount of estrogen that is in the body at that very one particular point of time. Just to make it very understandable, we have hormones all throughout our lives. It's just during menarche to menopause that our estrogen level will spike so that we can hold a pregnancy. So you don't get pregnant before menarche at puberty, you don't get pregnant after menopause because of the estrogen levels. So as the estrogen levels are shifting towards higher levels, we get periods a lot younger, right? But that also means you'll go into menopause a lot younger because our ovaries are only able to produce ovums at a certain number that we have in the ovaries. So if you don't get pregnant within that reproductive age group, you will continuously have your menses and you'll have your menopause a lot earlier.
You are saying that now kids are having more estrogen dominance. So can I say the toxic exposure, drinking from plastic bottles, the girls are starting doing makeup, exposure to Instagram, that's shifting their periods?
In our body, we have got a lock and key mechanism, meaning each hormone receptor can only be opened by a particular type of hormone. Let's just say you've got an estrogen receptor. You'll need an estradiol, which is E2, that can unlock that receptor. What we are getting from the environment are xenoestrogens. Xenoestrogens will not unlock your E2 receptor, but what it will do is it will clog your liver, meaning you have an overload amount of steroids or cholesterol. Any cholesterol that makes hormones are called steroids. Okay, these anabolic steroids will not be able to be broken down in the liver. So if the hormones cannot be broken down in the liver, something will change in your liver that causes your insulin levels to spike.
So obesity also.
So when insulin levels spike, right, at any one point of time, even if you are not eating much, let's just say you are eating 1 meal per day, but at that meal, if your insulin level spikes above say 25, you will store everything.
Really?
So the idea that hormones make you fat is not exactly true, because your xenoestrogens and all will not be able to unlock the estrogen receptor. But what will happen is your insulin will spike because of the amount of xenoestrogens that is, you are not able to methylate or break down that hormone. Okay, so insulin reads whatever that is in your liver to show that it spikes, it goes up. When insulin starts to spike, anything above 25, you will store. You can even run a full marathon and come back, you won't even lose 100 grams. That's the key to reversing obesity, is not your hormones. Your hormones are your chemical messaging system in the body. The key is to drop your insulin spikes.
Insulin spikes. Oh, so there is big industry of gym rats. They are taking egg whites. It's a big alarm for them, that because if you cut the yellow part from the egg and just take egg white, you're going to get much higher insulin spike. Is it true, right? At least that happened with me. I was putting this continuous glucose monitor chip and I saw oats messes me up. And if I take just egg whites, so I used to take 2 full egg, 4 egg whites omelette. Now I have shifted to 5 full eggs.
Okay, so if you understand, protein builds muscles. Okay, protein is not going to stop your insulin spike. Protein will break down. There are 3 components of food. You should know better than me. The 3 components of food, you have got carbohydrates, which will break down to only one molecule, glucose. Okay, so any form of carbohydrate in your diet will break down to either fructose or glucose. Glucose the muscle will use, fructose will go towards your visceral fat. Okay, you've got fat, lipids, which your cholesterol, which will not be able to be stored in the body, but it will help you reduce your insulin spike. Proteins are not going to reduce your insulin spike. Proteins are there to break down into branch amino acids to build muscles. Okay, so if you understand the 3 section of food, your carbohydrates is what's going to give you energy. Okay, that is your, what I call it is, your muscle is your charger, your branch amino acids, your glucose is your electricity that builds the charger, and this muscle is the one that will regulate the amount of insulin in your body. If you don't have enough muscles, you won't have enough insulin receptors. So what happens when you don't have enough insulin receptors? Let's just say one cell has got 1 insulin receptor, just for this description purpose, right? Now, if you have 100 cells and you don't, you eat something that is a lot. You have one nice gulab jamun, but gulab jamun here is made with dalda and not ghee. What happens is, it's only ghee, it's only the oils in the ghee or in the coconut oil that can reduce the spikes of insulin. So now you eat something with vegetable oil or dalda or whatever else, it's not going to reduce the spike, it's going to shoot the spike up.
Oh, so you are saying somebody eating gulab jamun with ghee will not get as much as spice than somebody is having with dalda.
Should come for my presentation. Okay, let me just explain a little bit.
You invite me to Malaysia.
No, I'm doing it.
Here.
Okay, the basis of bullet coffee is with ghee or with coconut oil, right? You don't hear bullet coffee with olive oil, or you don't hear it with sunflower oil. Why?
What I read was that saturated fat is good for your good cholesterol, and then once you blend it, it makes something called short chain or butyric, and it feeds your gut bacteria, is good for the brain. That's why you do coffee. Otherwise, coffee itself can give you an insulin spike, but at least in my case, but when I put in Miduty, we have something called fat burning chai creamer. It's MCT powder. So we've replaced milk with MCT powder. So that's what I use in my coffee.
Okay, you are on the right track. Okay, as my knowledge, if you put ghee into coffee, ghee will feed 2 microbiomes in your gut. You've got a lot of microbiomes. You've got like 40 trillion amount of microbiome in your gut. But the 4 microbiomes that you need to look after for weight loss is going to be your Clostridium, your Akkermansia, your Lactobacillus, and your Bifidos. Okay, all the Bifidos and Lactobacillus is there, but the main 2 bacteria are your Clostridium and your Akkermansia. What happens is they feed on ghee. They feed on the short chain fatty acids, which will produce something called butyrate. Without butyrate in the gut, your gut cells, your epithelial cells of the gut will not produce something called GLP-1.
Ah, that's Ozempic.
Yes. So if you understand Ozempic, why somebody has put it into a pen for us to inject to reduce is because we are bypassing the gut bacteria. But you can do it the natural way. Any food that has got oils, nuts, avocado, ghee, eggs, anything that has got oils will feed the Akkermansia and Clostridium in your gut and produce butyrate. Butyrate produces GLP-1. It's an incretin hormone. There are 2 types, GLP-1, GLP-2. But what it does is it slows down the bowel emptying time.
Yes.
So when you slow down the bowel emptying time, you don't spike your insulin. If you don't spike your insulin, it doesn't get stored. The function of insulin is to push glucose either into a muscle cell to function, or if the muscle is full of glycogen, it will push it into the liver. So if you have fatty liver, technically something is wrong. Right? We all love our food.
Right.
I love my food. Okay.
I see that smile on your face.
So whatever we eat, if you put a tablespoon of ghee into the food before you eat, you will never spike the glucose. You can do...
Can fiber do that job? Let me tell you why. You're not gonna like it, but I count my calories. Because out of nowhere in Dubai, I lived throughout my life in Germany. I would go to the organic market, the animals also. So I'm also non-vegetarian that we would eat. We won't eat so much of non-veg, but when we would eat, they are wild hunt animals.
Grass-fed.
Exactly. So I was so much exposed to good quality food. I don't know what happened. The moment I landed in Dubai, I had 5 kgs weight gain. So I've started counting my calorie.
Because you have taken the oils out of the food. Okay. When you are in Germany, you eat grass-fed foods, right? What does grass-fed food mean?
It means they are feeding off grass.
It means the grass that you feed off produces omega-3s in the meat. If you eat meat which is fed on corn or fed on anything but green grass, okay, it's the magnesium component that makes the omega-3s. If you don't feed them, if the animals are not fed with grass, anything that's green, they produce omega-6 and 9 and 12, which is inflammatory. Okay, you eat that meat which is inflammatory, what happens to the butyrate in the gut? It shuts down your Akkermansia. So if you shut down the butyrate in the gut, you don't have GLP-1. So if you don't have GLP-1 naturally in your gut, whatever you eat will spike the insulin.
Okay. But I started counting calories also to reduce my weight, and it did work a little bit. And the reason was I was walking a lot in Germany. Here in Dubai, I don't find nature. So my question was, let's say I want to trigger GLP-1, what Ozempic drug is doing. For the audience who do not know what Ozempic is, this is going to be next viral. This is already viral in Western, but now in India. So the clinical studies have shown that if you take Ozempic, please don't take by yourself. We can discuss about the side effects. And it's going to reduce 10 to 15% body fat in next 18 months once you start taking it. That then there are a host of side effects. But now what Dr. Sunita is saying, that if you start your meal with 1 tablespoon of ghee And what Ozempic does, it slows down gastric emptying. And she's saying you can do that with ghee. But my question is, if I do ghee before every meal, it means, it means 400 calories. And can I replace that with fiber? It has to be ghee.
Okay. When you say fiber, what sort of fiber are you talking about?
For me, fiber is vegetables. I have read that book called Fiber Myth, where they say you eat whole wheat, you eat brown rice. I know the shadow of these things. I don't do grains. When I say fiber, it's my veggies.
Okay. What does fiber do in the gut? It's like I'm tuitioning you now.
Yeah, do it. No, do it. I am such a curious, and my audience, my duty's audience is very curious people. So do that. You're asking me what does fiber do? So there are two types of fiber, soluble and insoluble fiber. So one bulks up the stool, and the other one is, I think, it adds bulk to your food so that you feel fuller with lesser calories. That's what I have understood.
Okay. Where do we get microbiomes from? Microbiomes are your probiotics.
From mommy.
No. Yeah, we did. We got it. But, 50 years down the line, mommy is gone. So where do you sustain your microbiomes from?
By feeding them prebiotics.
Okay, so where do prebiotics come from?
From pyaj.
No, insoluble fibers. Okay, so if you understand that we actually have to eat the soil, but we can't eat the soil, so what happens is we have a soil that is full of bacteria, full of microbiomes, full of nutrition. We take a plant and we plant the plant there. So what is the function of a plant is to absorb all the nutrients, absorb that nutrients together with the microbiomes into either the fruit, the leaves, or whichever part of the plant. We are supposed to eat that plant to deliver the microbiome and the nutrition into our cells.
Oh, I always thought from plants we are getting vitamins, minerals. We are also getting biome. But I wash my vegetables. I don't eat it with mitti.
It's not the mitti. It is the nutrition in the mitti. Okay, next question. What is soil? Soil is nothing but ash, right? So what is ash? You cremate a human, you get ash, correct? What is that ash? It's nothing but minerals.
Yeah.
Nothing else. It's just minerals, right? So you put mineral into our mouth, we won't be able to digest. We don't have the enzymes to digest minerals. But if a plant sucks it up and produces it as a leaf or a fruit or a stem, we can have that in our gut, which is being able to digest. Okay? So now we have a plant, moringa, whatever you want to call that plant, and it goes into our system. In our system, there will be microbiomes already there. You further replenish the microbiome in your gut by having the insoluble fibers.
Okay.
Okay? Yeah. So when you have insoluble fibers, what happens is it will break down and the microbiomes in the cells will be released.
I got it. When I was in Germany, as a part of insoluble fiber, I was eating a lot of asparagus, artichokes. Indian sabjiyan. So guys, first of all, doctor is from Malaysia and she doesn't know how to speak Hindi. But I told her in between, we have to little bit brush up her Hindi. So what you eat Indian sabjiyan? Yeah? Okay. So which Indian sabjiyan have insoluble fiber?
When we cook Indian sabjis, there's hardly any microbiomes left.
We can cook too much.
Yes. So any plant which touches 42 degrees, everything dies. There's not much microbiomes. The reason why we can transport plants is because the microbiomes are sitting inside the insoluble cells. So they are protected. The minute we cook the vegetables, everything dies. Okay? So we can ferment bread and become sourdough, but the minute we bake the bread, all the microbiomes are gone. So if you understand that principle, you need to understand that we need to eat the vegetable as a whole without cooking so that the microbiomes are still alive. There are two types of microbiomes. There's the spore and there's the live bacteria. So if you can get the spores in, it will germinate in the body. But the problem is, this is a tube. So there's an opening and there's an exit. Nothing is going to stay there very much. It will all come out. The only place where the spores can germinate or stay within in the body is in your appendix, because it's a cul-de-sac. Okay? But half of us have got our appendix removed already. So then we can't even store spores anymore in the gut. So what happens is you have to replenish your green vegetables on a daily basis. So
but not cooked one.
Not the way we cook Indian cooking. Hence why I keep telling people, if you want to have your food, there is taste, there is nutrition.
So lightly saute is okay?
As long as you don't fry it, you don't cook it, the outside is crisp, the inside is still raw, you are fine.
But if I give my community such type of food, they will fart and the house will become like a gas chamber. Am I wrong or right?
Okay. So now you come to soluble fibers and insoluble fibers. Soluble fibers have got microbiomes which will break it down. You won't have gas. The only part of the plant which produces gas is going to be your insoluble fibers. That's why chapati, wheat is gassy. You get bloated. We don't have the enzymes to break it down. Hence, you have to have a digestive enzyme, any type of digestive enzyme. A fruit is a digestive enzyme, which will go together with the food to break down the insoluble fibers.
Are you telling me that we can have, I know which fruits, pineapple is a very good example. Are you telling us that we can have one piece of pineapple with our little bit of half-cooked veggies?
In nature, we can eat everything. Okay? We only store calories if our basal metabolic rate is on the lower side and our insulin is on the higher side. That's the only two reasons why we are going to store calories. Okay? So if, let's say, you have a bodybuilder, you can't give him 2,000 calories. He won't sustain that kind of muscle build. So what happens is you give him 10,000 calories. But he will have a visceral fat or a body fat of, say, about 2%, 3%, 4%. Right? Why? Is because his muscles are there to increase the basal metabolic rate. So if you understand muscles increase basal metabolic rate, then you need to look at the thyroid levels of leaner patients or patients who do not have that much muscles. Okay? I work in an office all day long. I only have maybe an hour, 2 hours a day here and there if I can to exercise. So what do you want? How do you control somebody's diet so closely to the point where they are unable to function?
Really?
So what we do is, don't control the diet, raise the metabolic rate. So if you raise the metabolic rate by giving them thyroid, not the synthetic ones, the bovine, the desiccated thyroid, what happens is your basal metabolic rate comes up. If you detox the liver and methylation takes place, then you don't have a problem with your estrogen hormones in the body. So if you don't have estrogen dominance or too much of backup of estrogen, then your insulin will not spike. Even if your insulin spikes, your basal metabolic rate is on the higher side, it burns your calories. So we in medical school were taught to keep your TSH levels anywhere between 1.5 to 6.5, something like that. Then how come we all have got fatty liver?
We'll come back to fatty liver, but my question was these vegetables. Back to that question. So, inko club karna hai. So, back to that question that if you're eating broccoli, make it like outside soft, inside little hard. How do we digest that? But do we have to take extra enzymes, digestive enzymes?
Okay, so digestive enzymes come from either fermented vegetables or from fruits. So any food that has to ripen is a digestive enzyme in a layman's term, okay? Any fruit that has to ripen will come into the category of a fruit. The fruit ripens. No vegetable will ripen.
You mean to say like kacha banana?
So what happens, you take a banana, it's green in color, you put it on the table, right? After a while, the skin becomes yellow. After a while, you'll see black dots on the skin. After a while, the whole fruit disappears, you only have the skin. So where did the fruit go?
It got eaten by microbes.
Correct. So if you understand that the microbes are in the food, you will not have a problem with bloating or digestion.
So again, back to this question, to make vegetables, because after the podcast, let's say people start cooking their vegetables half cooked. I'm just worried they should not get bloated, and I know they will.
Okay.
So what to do for that?
My way of doing, you eat your carbohydrates a little bit, as much as possible with a lot of fiber, so that you don't absorb too much of glucose. You have your protein. If you can, drink your vegetables. So the idea of eating vegetables is for the fiber, right? But the idea of getting in without the fiber, the nutrition, without going through bloating, is you juice your vegetables, you get the nutrition, it all comes out in a form of liquid, and you drink it.
So you are saying that once a day we should do the super greens.
I am saying at every one meal you take, you have 1 glass of vegetable juice, not fruits, vegetables.
Yeah, vegetable juice means, for example, I'm asking you, let's take an example of celery. Yeah. Should I put it in a mixer and just take a juice, or should I put it as a whole stem and blend it?
Okay. So now when you understand that you want to extract the nutrition component, there are 2 types of extraction. One is blending, the other one is a slow juicer.
Yeah.
Okay. If you blend, any type of blender will have a motor. That motor consists of heat. Anytime you blend, that heat dissipates out into the food. Your microbiomes will die.
It dies only with that heat also?
Any heat at 40 degrees, microbiomes tend to die. Hence why we have a lot of problem with gut diseases nowadays, is because we are eating food which we keep, we reheat, the microbiomes are dead. Unless you ferment that food, the microbiome stays the same number, only through fermentation where it doubles in number, but any form of heat will kill the microbiome. So if you are going to juice for the nutrition purpose and you want to blend it and sieve it, not a problem. But if you want the microbiomes intact, you'll have to use a slow juicer. So the slow juicer will slowly crush the insoluble fibers and extract the juice, and a dry pulp comes out.
Yes. I had it in Germany, but I didn't bring it to Dubai. I thought, why would I need it? For the slow juicer, tell us some Indian vegetables that we can beautifully blend. One is raw beets.
Okay, my daily juicing. Let me just give you an example.
I'm going to note down. I'm going to go and drink right away when I get into Dubai.
My daily juicing would be 1 lemon, lime, whichever form you get, 1 orange with the skin, a bit of ginger,
Okay.
a bit of turmeric. It's either going to be celery, beetroot, it's going to be mooli, white radish, it's going to be your gourds, your white pumpkin or the bottle gourd, aloe vera.
Bottle gourd. Okay.
Aloe vera.
Okay. Aloe vera is the same aloe vera wo garden pe jo lagta hai. We can consume it like that, the one we get in the garden. So we take it and we put it in the blender.
In the juicer.
With your peel?
Everything in.
Is it safe? Is it not full with pollution?
Wait, we'll get to that. And moringa leaves or curry leaves or basil or tulsi or pudina. So as long as you get a little bit of everything, you get it into your juicing, you have the nutrition. On a daily basis, I would normally tell patients, you get aloe vera in, you get beetroot in, you get celery in, and you get your ashgot. Why? Because beetroot is nitrogen oxide. It dilates your vessels. Your aloe vera is for your detoxification and your gut problems.
Gut lining.
Then your moringa is for your liver, homocysteine level, methylation levels.
Awesome.
Okay, so you have a little bit of everything. So if I give you an entire broccoli to eat, right? How much can you eat? 3, 4 stems, 5 stems, maybe you won't eat the entire broccoli. But if you juice that broccoli, you'll get about 2 centimeters, a little bit, right? So you can do one whole broccoli and maybe celery today. Tomorrow you'll do mooli, white radish with carrots. The day after tomorrow you'll do ashgot.
I used to give juice to my parents every single day, and we used to also add, for example, spinach, or we would add these superfoods called wheatgrass. What happened? Their potassium level in the blood was high. So I stopped the juice actually.
When you do juicing, it's very concentrated amounts.
Okay. Maybe they were doing it
too
big
much.
glass. How much should we consume? Like a big glass, like 50 ml.
Now it depends again on what's in that glass. If you do 50 ml of spinach,
it's a lot of potassium.
That's a lot of potassium.
I get it. Ke if you have to give water, like a juice, what does that contain?
Correct.
Okay, I get it.
So if you understand that your microbiomes is coming from your fruits and vegetables, then it makes a lot of sense to juice your vegetables, because you want the nutrition and you want the microbiomes without destroying the bacteria.
So are you not scared with orange? It's fructose.
We need fructose. We need some form of fructose. Any food that we eat will have 2 types of sugar, fructose or glucose, right? Your liver needs to store some amount of fructose. Otherwise, you can't balance your glucose and fructose level. Let's just say you're on a flight. I just flew from Kuala Lumpur to Goa. It takes me 17 hours to get here.
Really?
So on that 17 hours, I'm not going to be eating much, because you can't get the foods which you want. You don't eat for 17 hours, okay?
I was also fasting, always.
So where is that glucose supply going to come from?
From the stored glycogen.
Correct. As long as you don't cross over into fatty liver, you need the stored glucose levels, which is fructose. Okay? Because if you don't, and let's just say something happens, or you don't get food for 17 or 18 or 20 hours, how is your brain going to function?
But then how keto community is performing so good from the brain? They don't eat carbs.
Because you've got nature made it in such a way that you will get energy from 2 forms, either from fat or from glucose.
Okay, so their energy source is different.
Correct. When you get energy from glucose, you make 36 ATP molecules. So ATP is the
Currency of energy.
currency of energy. If you get energy from oils, from your fat, you get 9 ATPs. So if you keep going just on keto diet alone, right? Unless you are a diabetic where you can't handle glucose, how long do you think you can sustain with a level of LDL that is so high? Unless you have thyroid with it, where you can burn the LDL and it doesn't plug your arteries. So if you are on a keto diet, let's just say, your LDL levels will definitely be on the higher side. I've never seen any patient who's done keto diets with a normal LDL. Correct? But we only see it for the first 10 years of their lives. What happens when they cross 20 years and 30 years? LDL level on the higher side with your HDL not as high as your LDL, you are going to plug all your small arteries. You're going to end up with a stroke.
Okay, so carbohydrates are important, but quantity is important.
The key is balance. It has to be balance for your metabolic rate. Right?
So yeah, guys, so one of the strongest probiotic is here your green juices. And I repeat, lemons, orange, ginger, turmeric, celery, beetroot, mooli, aloe vera, and then any kind of leaves, moringa leaves, curry leaves, pudina, anything. Okay, or dhania. And ashgord.
On a daily basis, because it's only the aloe vera and the ashgord which will protect your liver and your gut lining.
Which one? Aloe vera and?
Ashgord.
Ashgord. Now, regarding aloe vera, it's outside, it's with pollution. Do I take it?
Okay. Which part of the world is not polluted?
Maybe up at the North Pole.
Every part of the world is polluted. If you understand, water becomes cloud, cloud becomes rain, cloud moves, right? So wherever the cloud is going to move, you are going to carry that contamination unless you are doing hydroponics. But again, with hydroponics, you are putting nutrition into water. Where does the microbiomes come from? Okay, so my way of doing things, why don't you make your liver so strong that you can detoxify anything?
Okay, so we'll get back to that, how to make liver strong. Can you give us home remedies and supplements or juices, how to make liver strong, or lifestyle choices?
There is something in the liver that will control our entire detoxification mechanism. Okay, so in the liver there are two phases. Phase 1 is your conjugation phase, and your second phase, which takes what breaks down, and the other one makes whatever non-water soluble water soluble, conjugation phase. Okay, detoxification phase, you will need a lot of supplements. If you see the liver mechanism, you'll need magnesium, you'll need NAC, you'll need vitamin C, you need quercetin, you need ALA, you need a lot of nutrition to break down substances. Okay, where are you going to get all these substances and minerals from? Unless the meat you are eating has fed on greens, you will not be able to get the substances. So it only comes back to one thing: plants. Right? So if you understand that each plant and each leaf holds different types of minerals, hence why their color is different, the shape is different, then you will forage on all those plants which will give you the minerals which you don't have. If you are a vegetarian, you are not going to take meat, right? So where's the iron going to come from? Beetroot, raisins, anything purple, right? So where is your vitamin C going to come from? It's not going to come from anything that is purple in color. It's going to come from the yellows and orange colors. Hence the amla, which is like the lime. Anything that has got yellow tinge, orange tinge will give you vitamin C, quercetin levels. Anything that has got purple tinge will give you your nitric oxide, your B12.
You said iron.
Iron.
Yeah.
Okay. Anything that's green will give you magnesium. So if you don't eat vegetables in the amounts which you need,
that's huge amount, So doctors recommend 8 cups of vegetables.
I tell my patients 60 servings of 60 different types of vegetables per week.
Nobody can eat that. How?
Juice.
How many glasses of juice should I take?
If you're going to eat 3 meals, 3 glasses. If you do 1 meal per day, then you do 3 glasses when you open your OMAD. So if you understand that minerals are going to come from plants, then you will not overfeed on meat and carbohydrates, because carbohydrates are just going to give you calories. Animal feeds, your proteins are going to come from your meat technically or anything else, but it's going to give you muscles. It's not going to give you minerals. The main source of minerals for detoxification comes from the plants. So if you don't have your vegetables in the correct proportion of greens, purples, yellows and whites, then where are you going to get your minerals from?
I understood. So you said liver has 2 detox pathways. The first pathway could be supported with nutrients like ALA, NAC. So we have one supplement called liver detox with NAC, and magnesium. And how about second pathway?
So the second pathway binds all the non-soluble products with the bile that's produced by the liver, and it makes it water soluble. So you have your liver, which breaks down substances, and you have your gut, which prevents constipation. Correct? So you can have a very good liver, but if you're constipated, it's not going to work because the factory breaks it down, but you can't eliminate the toxins. So what happens is you need to make sure you pass motion on a daily basis.
How many times is okay?
We have been trained from young to pass motion once a day because that was convenient, right? But technically, it has to be 2 hours every time you eat. After every meal, 2 hours, you are supposed to pass 2 to 3 times a day.
I was worried about my daughter because after every meal, she goes to the bathroom. So I consulted so many functional doctors, and today I got the answer that she's doing the right and we all are doing
correct. Okay. So when you have a child, you feed the baby every 2-3 hours. How many times do they pass motion?
Every time after the meal.
Exactly. Because they have not been trained. Once you go past 5 years old, we all train the kids to be potty trained. And what does that mean? Get up morning, have your potty, because the whole day you're out of the house. Okay?
Yeah.
So we are all constipated, technically, unless you are able to defecate the entire volume at one go. So if you don't move your bowels nicely on a daily basis...
How to move the bowels?
Thyroid.
With thyroid.
So what gives the bowels peristalsis? Energy. So what hormone do you know that codes for energy? So it's your thyroid. So when you have low thyroid levels, we'll do a blood test. And I'm so sorry to say I was trained that way also. We do a blood test, and if it falls within the thyroid range, it's normal. But then the patient is telling you, I'm not passing motion daily.
So constipation is low thyroid.
Constipation equals low thyroid. That's it. No other reason why you are constipated except low thyroid levels. If your thyroid levels are good, you have got enough energy, currency energy, to move the gut. Peristalsis will take place, right? When peristalsis takes place, you will move your bowel. You'll move it 3 times a day. Have you ever seen any baby born that's constipated?
Now, yes. Now with formula milk, especially that are not breastfed, and they are now constipated.
Okay.
Yeah.
Put those artificial food babies aside. The natural ones.
No. I've never seen them constipated.
Right?
No.
Why?
Mother's milk. I don't know. Okay. Their thyroid is working properly.
No. When a baby is born, the baby is delivered, you have got an umbilical cord, you cut the cord, you have got all the stem cells which is pushed back into the baby. You've never seen a baby that does not grow. You will see a baby that is retardation of growth, but you'll never see a baby that does not grow. Correct? Why? Because a baby is born with a lot of stem cells. That's why babies grow. You reach the point of 12, 13, 14, okay, we give it 16. After a while, our bone starts to fuse and the stem cells are locked within the bone marrow. Okay? Then, after then on, stem cells are only released when needed for repair. But before the fusion takes place, stem cells are circulating throughout the body because you need to grow. You need to grow organs, you need to grow brain tissue, everything else. Correct? So when you have all these stem cells circulating, you hardly get any baby that has got low energy levels.
Oh, yes.
It's the mother that has got low energy levels.
Don't remind me that.
The baby is bouncing around all over the place. If you see a baby that's not bouncing around, that's an emergency. Okay? Because they've got all the stem cells that can make the basal metabolic rate optimal. As we grow older, the amount of stem cells reduces. That's how we were coded for. We slow down, we sit in a chair, we don't have energy, we lie down and we pass on. But if you keep putting back the stem cells into the person, what happens? Nothing.
Energy. No?
Exactly.
Yeah?
Energy carries on, repair carries on. If the repair carries on and the energy carries on, then there's no lack of currency.
Dr. Sunita, you said that stem cells are not very expensive, whereas I knew always that Bollywood, Hollywood actors, actresses, they are all doing stem cells, growth factors because they are very expensive. And I do understand that you are doing stem cells in your labs in Malaysia. So guys, I will put Dr. Sunita's contact details. If anybody has a liver issue, you know, you have to grow your organ back, a liver, a heart, what else, intestines, whatever. You go to Dr. Sunita to Malaysia. We will put her details. But for people like me who doesn't want to go to Malaysia, but your skin is right now better skin than my 7 years old, and I can guess there are stem cells behind it, right?
A lot of nutrition.
A lot of nutrition.
A lot of, stem cells are there, but stem cells will not function on its own without the nutrition support.
Okay.
So if you understand that, we have got so many stem cell companies in the world. Anyone goes by a clinic gets stem cells. Okay, it's so rampant already, but it will not function to the optimal rate unless you have got good nutrition. So now your question is, how do we get our stem cell up naturally
without coming to Malaysia?
Your plants. Only by having your fruits, vegetables in raw form, meaning you get all the microbiomes, you get all the nutrition, then your body can produce its own stem cells. You have stem cells in the body. It's just that how much you need to overcome a disease. Now we have a disease because one of our pathways are blocked. Correct? Okay, give you an example. If you like alcohol, alcohol is toxic.
No, I don't like.
If you do,
do you like?
I don't drink.
Okay.
So if you do, how I monitor patients with liver problems is you get them to drink vodka, 40% alcohol, anything with 40% alcohol. If you don't get high with 40% alcohol, what does that mean?
That is my problem actually. I don't drink because I don't get high. It means
no, you don't drink because you don't get high.
Yeah, because it doesn't give me, I see other people having fun, and for me drinks are no fun because I take 1, 2, 3, I remain the same.
Correct. So that's where your milk thistle comes in, because milk thistle is the one that codes for something called glutathione function. So if you have enough NAC in the body, it will break down or it will form glutathione. Glutathione detoxifies alcohol. So if you've got
you
enough...
are telling my audience that take liver detox supplement and start drinking alcohol.
Yes. So most of my patients who come, they'll tell me the same thing over and over again. You do whatever you need to do, don't change my lifestyle. That's not possible, right? Not possible, because if you like to drink the whole night, how am I supposed to look after your liver? I can give you stem cells to repair, but it will not sustain the detoxification process. So if you understand that stem cells are not going to help with sustaining function, it just repairs. You still need the nutrition to sustain the function, hence the milk thistle. Milk thistle breaks down alcohol.
Ah, okay.
Okay, glutathione breaks down alcohol. NAC converts into glutathione. That's the reason why we do.
We have this supplement called liver detox. It has NAC, milk thistle, dandelions, like whatever you mentioned. What if somebody has done the damage to the liver by drinking alcohol? Okay, I can give now NAC, but how can I take off that damage?
You can't. That's where the stem cells come in. So if you already have liver fibrosis, right? Now, if that liver is fibrosed, that means there's a scarring tissue. You have your own stem cells in the body. You should be able to repair.
I eat dark chocolate, so I don't do cacao. They regenerate stem cells. No? They are lying?
You are born with just that number of stem cells. Okay. If you wear out your stem cells fast, let's just say you're a marathon runner. So if you're going to run 50 kilometers every week, your ligaments will definitely have lots of wear and tear. Correct? So what happens? Your stem cells will be utilized to keep those repair going on till the point where either there's not enough collagen, there is not enough amino acids, or there's just not enough stem cells that can regenerate the cartilage. Then you end up with osteoarthritis. Okay? So to the point where your body runs out, you can stimulate the stem cell release from your bone marrow.
How?
Any form of food which is there, stem cells will, if you have an injury, let's just say, if you have an injury in your body, stem cells will be released. Okay. One favorite thing which we all do is mesotherapy.
Oh yeah, I love it. I do it every 2 months,
Okay.
and it has made tremendous change in my skin texture.
Why?
So the science is you give a wound deliberately with pins on your face, and then the blood comes with growth factors to repair it.
Stem cells.
It's
So
a stem
any
cell.
injury to the face. So mesotherapy normally is either manual or they use a gun, right?
Yeah, the pen.
Pen, gun, manual. Three. Okay, like for me, I use a gun. It's a meso gun.
Whoa, that with a rectangle.
Yes.
I bought a meso gun in my house in Germany. I put it here in front of the mirror and I was looking and I couldn't pull the trigger. Because guys, kya hai meso gun? So you put cream, if you want the delivery in all 6 to 7 layers in a very concentrated form. So from Korea, I got very nice serums. I put it on the gun, I put it on my face, and then because right now the house caretaker in Germany, she was asking me in the video call, ma'am, what is this gun? I was like, throw it. You cannot do by yourself.
Very difficult. I can't.
You can't do that? I can't do that
Can't
too.
inject myself. If somebody has to inject me, it will only be my sister because she's a doctor herself. So the trust issue is there because I know the complications that can occur. Okay, so let's just say meso gun. Okay, the meso gun which I have has got 300 needle pricks per minute. So you run 300 pricks in, say, over a period of 20 minutes, right? What happens is you create small injuries. When you create injuries, you have a release of cytokines that tells your bone marrow, guys, there's an injury here, come and repair. So all your growth factors will go towards this area to repair. But with that growth factor, your stem cells will be released from the bone marrow. And that bone marrow stem cells or the fat stem cells will be released to repair the injured area. So if you think that thin is nice, you don't have much stem cells if you're thin.
Really?
Unless you have at least 10 to 15% body fat. Because stem cells are stored in your fat and also in your bone marrow. You can run out of stem cells in the bone marrow, but fat cells will store stem cells along the way. Correct? You don't see much, not to say obese is bad, but healthy with a bit of body fat, age very fast.
Yeah.
Those who age very fast are the ones who are the nice, very lean, we call them skinny fellows. By the time they touch 40s and 50s, everything is sagging. Because the stem cells run out from the bone marrow. But the fat stores some amount of growth factors.
Yeah, now my audience will start getting fat. They will
Not
say,
fat. We need at least 20% body fat to be healthy. Healthy in the sense that we have enough stem cells to heal whatever injuries we have.
okay, so eating plants for stem cell regeneration, having a good healthy weight for stem cells, what else? And then injury, but then it's only for the face,
Okay.
I want stem cells for my all organs.
Okay. So if you understand that stem cells will come either from an animal or from the plant, then you eat the animal parts which you want to regenerate.
Yeah, I've
Correct?
read that. Yeah. You have liver cirrhosis,
You
start
eat liver.
eating liver.
Correct.
Yeah, you have brain problems, start eating brain, because in Germany they give something like minced meat, and that's the cheapest meat because nobody want to buy it. So what people do is they put little bit of this minced organ meat everywhere, and yeah.
So if you understand that portion of it, what you do is you want stem cells. Go get bone marrow.
Oh,
You get fat, lard.
bone marrow and lard. Yeah, and lard is also very good for the face, right?
Yes.
So many people are now using lard on the face.
So
lard to eat?
Yes. So if you understand, if we all understand that stem cell is stored in fat tissue, ghee is fat.
Yes. I do my my veggies sometimes in lard. We get in Dubai too. And okay, so lard has stem cells.
Any form of animal fat will store some amount of growth factors and their stem cells.
And
That's
how?
why.
And okay, so the vegetarians will do juices, and the non-vegetarians can do the fatty part.
Correct. Agreed. Only one thing you need to understand also is that heat will destroy stem cells. So that's why do not cook your vegetables as much as possible, number one.
But I cook with lard.
If you fry your vegetables with lard, the fat is already dissolved on the fire. There goes your stem cells.
They are gone? So how do I take lard like that?
Bulletproof coffee.
Okay.
You're getting the picture.
Okay.
So it's the ghee that has got the stem cells in it. It's got the milk that has got the cholesterol and all the
ghee is made from the heating process.
There are many ways of doing ghee. You need to get the correct way of doing the ghee. Okay, ghee.
There's only one way. I see in my house, my whole house smells bad, and there's ghee. I was like, Mom,
Butter?
did you make ghee today?
How do you get butter?
Yeah, one step after ghee, one step
before ghee.
One step before. So I see butter, and then I see ghee.
So butter will have your stem cells. Anything with fat in it will hold some form of growth factors. We won't call it stem cells, okay, because it means cell. But it will hold the growth factors to repair your body.
Okay. So one more reason to get desi ghee laddus in the diet. Awesome. In the starting of the podcast, you mentioned about that the women are getting, or the kids are getting periods because of estrogen dominance, and the menopause is also early. What is the right age of menopause?
There's no right age. There's no age for menopause. There's no early or late menopause. It's just going to depend on the cycles of eggs that you have. You run out of eggs or ovums in your ovaries, you go into menopause. Okay? So if you are someone who have got multiple pregnancies, so multiple pregnancies means that 9 months you are not going to ovulate. So you are going to stretch the time of release of eggs a lot longer.
Oh, so should I get pregnant to get my periods till 60?
That's why we have bioidentical hormones. Because then we mimic the amount of estrogen, testosterone, progesterone. We pass menopause to maintain the muscle, the bones, the chemical messaging system.
Okay. So there is no right age. If you go naturally without bioidentical hormones, it is the number of pregnancies you have, it pushes away because for me, bleeding is a blessing, because I know what happens to a woman's body immediately after menopause, especially with the bone density.
That's because with menses, you have E2, estradiol, which helps with the bone density and the cardiac muscles, your heart muscles, okay, and your brain. But if you can replace this E2 without having your menses, you have the same effect. Just make sure it's bioidentical, not synthetic, because again we come back to the lock and key mechanism.
Yes. Yeah, because one of the reason for women getting low on progesterone was they were on birth control pills, because birth control pills were giving this progesterone effect, and if you don't have progesterone, you are a mess actually, your mood swings and you can tell better. So one question back to menopause. After menopause, women loses bone density. Let's say they do not have the possibility to get bioidentical hormones because there are so less doctors in India. What should they do naturally so that the bone density is intact? Because there's also the calcium in the equation. One should not take calcium supplement. Then where is calcium coming from?
Bone density doesn't equal to estrogen. Bone density equals to your calcium, magnesium, your selenium, the mineralization of the bone. It's the estrogen in women and the testosterone in men that binds the mineral together in the bone. Okay, you've got, even if you have a lot of hormones in the body, without vitamin D3, you will not be able to absorb the calcium from your gut. So now you have calcium coming into the bloodstream, but you don't have vitamin K2. You can't push the calcium out into the bone. So you need three things that are very important for mineralization of bones. You need your vitamin D3 to absorb the calcium, you need your K2 to push it, and you need magnesium. Without the magnesium, just imagine you've got calcium that's sitting in your arteries and it's circulating all over the place. At some place, it will deposit and form an arteriosclerosis. You don't have magnesium, the stone forms. You have enough magnesium, that stone dissolves. So the key to having good bones is your green vegetables. Because
Moringa.
Green vegetables in any form.
Any form.
Because the nidus for green vegetable is magnesium. Okay, it's the magnesium that holds the chlorophyll in place. So if you have enough green vegetables, then you have enough magnesium in the body to prevent calcification. But you still need your vitamin K2 to push that calcium into the bone. You never run out of testosterone. We always have got some form of hormones in the body. And if we have, even though we go through menopause, we still have some amount of testosterone in the body, because it's the testosterone that binds the bones and it's the testosterone that builds muscle. If you don't have testosterone in the body, there's no way you are going to build muscles. Then you're gone.
Yes. Okay. So you are saying that even your estrogen has dropped after menopause. Don't worry if you're taking vitamin D with K2, with magnesium, with minerals like selenium, and you are good with your bones. Oh, yeah, because we did DEXA scan for some of our patients and the bone density was really compromised, although we were giving vitamin D. I was not recommending calcium supplement, but now I have found a form of calcium supplement. It's called calcium AKG. So that one can take. So now we're going to launch under Miduty also.
But you still need K2.
Yeah. Okay. Because we have a supplement called ADK, D with K1, K2. When I was doing my research, I also read that K1 is important. So yeah, so K1, K2, D, and with vitamin A also, because Indian beings vegetarian and their livers are clogged, and this conversion of beta carotene, they say we had gajar and we had our vitamin A. No, it has to be converted into retinol palmitate. So we put that salt there. So we have ADK supplement. So what did we learn from this podcast? Number one is
eat your vegetables.
Eat your vegetables. You are right now speaking like Dr. Terry Wells. She has multiple cirrhosis and she was on a wheelchair. So the book cover starts from wheelchair to running marathon. How did she do that? And then she revolves all around, she even says to integrate sea vegetables in the diet.
Absolutely, especially seaweed and blue algae.
We do this sushi cover, what is it called? It's a paper. Seaweed. I have seaweed chips, but I have stopped taking it recently because right now in Germany, it was written that it is from a place where there was no nuclear activity because they're coming from Japan. And in Dubai, they don't specify that. So for that very reason, because it also has iodine, and we've been taking only Himalayan pink salt. So what is the source of iodine, right? So I was giving that chips as snacks to my daughter, and suddenly I've stopped it. So is it okay?
Back to, if your liver is strong enough, you can eat poison, nothing will happen.
Work on liver.
Yes.
Work on liver. Okay. So what did we learn to work on your liver? There are two types of detox pathways. The number one, the first one, eat your veggies. And N-acetylcysteine is important. Milk thistle is important. And the second one was the second detox pathway, which was supported by your
Bile.
So the people who don't have gallbladder, their second detox pathway is compromised?
If you don't have a gallbladder, your liver will still produce 10% of the bile. So you will still be able to pass motion, you will still be able to absorb your omega-3s, but not that much.
If we give them ox bile supplement.
I give all my patients ox bile supplements.
Yeah, we also have this supplement. It's called Digest Fat. So because my mom and dad's gallbladder is gone, and I give them ox bile with every fatty meal for vitamin A, D, E, K to get absorbed. So if a person with no gallbladder takes ox bile with every meal, do you think they can still support the second detox pathway?
Yes.
Yes. So ox bile is the key, guys, here. Okay. I totally buy that. So, okay. Thank you so much, Dr. Sunita. So we have so much of learning, and I'm definitely coming to Malaysia for my stem cells. So guys, I mean, this is in front of the camera. She's sitting here and her skin is like my daughter's skin. So she's definitely doing something good. And yes, thank you so much. And guys, if you want anybody she has got a very good research in cancer, that's actually her main core. Cancer, when the doctor has said chemo won't work, you have less time, where do we go? You go to Dr. Sunita in Malaysia. And when it comes to, let's say somebody has a liver failure, or the heart is not working, any organ is compromised, I asked her personally. She told me, you just have to come once to Malaysia, and she's gonna do her thing for 1 day, 24-48 hours, and then you fly back, and after 6 to 7 months your doctors will say that your organ is back. How much percent?
We aim for 100%. If we achieve 80%, is very good.
Okay, thank you so much, Dr. Sunita, and I'm so much looking forward to do one more podcast with you very, very soon in Malaysia or during next visit to Goa.